Hello, Dr. Raju. I'm going to start the lecture on the polycystic ovarian disease. Okay, in short, we call it PCOS, that is polycystic ovarian syndrome, or PCOD. Okay, so let's start lecturing in this part because I need to write and the drawing the picture. Okay, let me give you a little introduction of the polycystic ovarian disease. We also call it polycystic ovarian syndrome. The question is, why polycystic? Polycystic ovarian syndrome, okay, or disorder or disease. So now polycystic means multiple cyst. Ovary has multiple cysts, we believe it, we believe, but one of the cysts will turn into Graafian follicle. But here in polycystic ovarian disease or syndrome, the multiple follicles in the cortex are growing at the same time. And they maintain almost the same sizes and they grow together all around the ovary. But none of them having ovulation. None of them having ovulation. So then what happened? If there is no ovulation and there is no egg and no fertilization, that means they are infertile. But there are some treatment. Sometimes they get cancer. And there are some treatment artificially, so manually they do something and they can have baby. Okay, so now polycystic ovarian syndrome. We have to understand that this polycystic ovarian disease or syndrome is bilateral because it's a genetical disorder. It may run in the family. And it is always bilateral. At the same time, both ovaries has multiple cysts all around the cortex, and it looks like a pearl of string, means it looks like a diamonds or pearl is setting all around, and it also known as Sten-Leventhal syndrome. Okay, so now let's give you the fundamental informations about the ovulation, so then you will understand that where is the problem in the polycystic ovarian syndrome. So normally this is the ovary. Ovary has the cortex, right? So this is cortex, this is medullary part, and the cortex has a primary follicle. Primary follicle. We call it oocyst. So primary follicle, under the influence of certain hormone, it turn into a Graafian follicle. Okay, and this hormone name is follicle stimulating hormone. That follicle stimulating hormone comes from pituitary gland. Pituitary gland. Okay? Follicle stimulating hormone, by the name we understand that it stimulates the follicle to grow from primary to secondary. And what's the other name of the secondary? We call it secondary follicle. We call it Graafian follicle. We call it Graafian follicle. And on the 14th day of period, menstrual period, the ovulation takes place. That means the egg will come out from inside. So this is the egg inside, and that egg comes out. We call it ovulation. And it is 14 plus minus 2. That means 12 days to 16 days. These are 4 days are very important. And this is the ova or ovum. And this ovum will unite with a sperm, and this is sperm, and will make fertilization and will form a zygote. Will form a zygote, right? And this is one cell, 46 chromosome, zygote, 46 chromosomes, because the ovum has 23, sperm has 23, they together makes 23 pairs, and that form a zygote. Total chromosome is 46. Okay, so this is the normal phenomenon. Every month from the alternate ovary it happens. That means every month there is a chance of fertilization. With the influence of the follicle stimulating hormone, and the ovulation is due to the surge of luteinizing hormone, LH. That also comes from pituitary gland. Okay, so this is the time of ovulation, and that ovulation, that is 14th day, there will be release of or surge of luteinizing hormone that comes from pituitary gland. Now, this luteinizing hormone release depends on the level of estrogen. Who produce the estrogen? The cortical cells, the cells around the follicles, they produce estrogen. Estrogen is a female hormone. Okay? So now, from here to there, by say the follicle stimulating hormone, it starts working after the period. Period, say it is 5 days, and from the 6th day until the ovulation takes place, the estrogen hormone is going up. Okay, so now if I draw this diagram, 28 plus minus 2, this is the menstrual period. So this is 14th day of the cycle, and this is 5th day. So this period is menstrual phase, and from here to there, 5 to 14th, we call it proliferative phase. And from 14th to 28, we call it secretory phase. Secretory phase, right? And now draw a line on the 14th day. I'm just showing that how the hormone estrogen released and it touched the finger of the LH and the ovulation takes place. Okay, so now this is day of ovulation. The estrogen level is going like this. See, estrogen level during the proliferative phase, and also this is known as the pre-ovulatory phase in the ovary. Okay, so this is ovary. And now this is the peak time, that is the ovulation day, which is called 14th day. And this is the cutoff point, and estrogen is increasing, and it touches the cutoff point, and right away the LH, luteinizing hormone, is released. As soon as the luteinizing hormone is released, then ovulation takes place. Ovulation takes place. Let me draw the this is egg. Okay, the ovulation takes place and the ovum is released, and ovum is surviving after released 3 to 4 days, and they will be waiting for the sperm, and sperm also can survive 3 to 4 days. So there is a chance for fertilization. Okay, every month it's been happening. The estrogen level goes up, luteinizing hormone released, and the ovulation takes place. As soon as the ovulation takes place, the estrogen level drops. Estrogen level drops. Okay? And at the same time, the progesterone okay, progesterone level after ovulation progesterone level after ovulation goes up. Why? Look at here, during ovulation, progesterone level is low, estrogen level is high. As soon as the ovulation takes place, the corpus luteum is there, and there is an active corpus luteum. That corpus luteum produces progesterone, and the progesterone level is high, and it's sustained up to the the beginning of the next period. Okay, and this progesterone level is high. Look at here, secretory phase, estrogen level is low. During the proliferative phase and the menstrual phase, look at here, progesterone, estrogen level is going up during the proliferative phase, and progesterone is going down during the proliferative phase. Okay, so this balance and ratio of the estrogen, progesterone, follicle stimulating hormone, and the luteinizing hormone. So these four hormones, what are those hormones? Estrogen, progesterone, follicle stimulating hormone, and luteinizing hormone. These four hormones in the regular cycle for women maintain a certain ratio during menstrual phase, during proliferative phase, during secretory phase. Okay? And if this ratio or balance is imbalanced, ovulation will not take place. Ovulation will not take place. And there will be a false signal to the primary follicles. Hey, let us grow all together. And there will be multiple follicles. They are growing, and at the middle they stop growing. None of them are turning into Graafian follicle. That means there is some imbalances among all those hormones. That's why polycystic ovarian disease or syndrome will take place. I hope you are understanding. And these imbalances can be corrected by giving the birth control pill that has estrogen, progesterone, and that can regulate the disproportion of the hormones, and the girl will have period every month regularly with the oral contraceptives. Okay, and those who are with too much anxiety disorder or some other psychological disorder, personal disorder, that may cause irregular period. And it's common. It's very common among the families, among the society. Okay, it's very common. Okay, so now this is the main concept of the polycystic ovarian syndrome development. And now how do they look like? Okay, let me draw the ovary here. Okay, so this is the complete diagram of the female reproductive system inside, and this is the ovary. Okay, so this is ovary. So this is left ovary, and this is right ovary. So this ovary looks so big. Why? Because okay, and I'm drawing here little different because I saw this type of follicles. Some places they count the follicles, and it's very hard to count the follicles, but at least when they found 20 follicles almost in the same size growing within the ovary, they considered that it is the polycystic ovarian disease. See, none of multiple follicles, but none of them are turning into Graafian follicle. So there will be no ovulation. So now, because of that follicles are growing, the ovary will be bigger, and ovary will be heavy. The volume of the ovary is bigger, and the ovary will hang down through the ovarian ligament. So this is ovarian ligament. This is fallopian tube. This is uterus. This is vagina. This is cervix. Okay? Fallopian tube. This is ovarian ligament. And these are the follicles. And how do they look like? They look like string of pearl. String of pearls appearance, and also known as Steen-Leventhal syndrome. Steen-Leventhal syndrome is the name of a person, still Leventhal. So now, sometimes these two big ovaries can be palpated when the doctor examine through the vagina. They insert the finger and they check the side wall of the vagina, and the ovary can be touched. Okay, it's so heavy. This type of big ovary is hanging by the ovarian ligament and also the suspensory ligament. It can be twisted. As a result, this type of big ovary can be torsioned. So patient may come to the ER emergency with the torsion of the ovary. Then you are scanning or found, oh my God, such a big ovary, edema swollen. Oh my God, is this savable? You have to click the color, power Doppler, then check the ovary is still alive or not. Okay, so this syndrome is characterized by menstrual irregularities, hirsutism, and infertility. This type of disease usually happens those who have testosterone level is high. So female has also testosterone androgen level, male hormone a little, because the adrenal gland, zona reticularis produce the gonadal hormones. So I am a man, but still I have a little amount of estrogen. Then if a girl has more male hormone, more than the normal, so they will develop musculature, acne, mustache, then hirsutism, and central obesity and a moon-like face. Okay, and lot of acne in the face, and they are suffering polycystic disease of the ovary. But this polycystic disease of the ovary is not associated with polycystic disease of the kidney or any adult polycystic diseases. No, that is different. That is also genetical, autosomal dominant. This is autosomal dominant too, but they are different genes related. So usually it is found in the women, those who are in their 30s. Okay, usually. And they are unable to conceive because of the irregular period. Sometimes they have amenorrhea, an ovulation with or without amenorrhea. Okay, and the patient